Did you know? Approximately 2/3 of people struggling with a substance use disorder have experienced some type of physical or sexual trauma during childhood. My name is Christina Catalano, and I'm the Deputy Director of Learning and Development here at Phoenix House. Victims of childhood traumas like abuse, neglect, loss of a parent, family member that suffers from mental illness or is incarcerated are more susceptible to substance use disorders and behavioral addictions than people who did not experience traumatic stress as a child. The ACE study, which stands for Adverse Childhood Experiences, suggests that there is a dramatic link between adverse childhood experiences and risky behavior, psychological issues, and serious illness. Another study found that the greater number of trauma-inducing factors a child experienced, the more likely the child was to engage in substance use to a level of disorder, resulting in low grades and disruptive behaviors in school. So how does the experience of childhood trauma increase our vulnerability to addiction? Well, our brains develop in response to the social, experiential, and biological circumstances in our early life. If these circumstances are positive and calm, normal, beneficial brain development is likely to occur, allowing a person to thrive in most conditions. On the flip side, a negative experience or circumstance can alter healthy brain development, predisposing the person to conditions of anxiety and chaos. In some cases, children who have experienced trauma have adopted substance use as a maladaptive coping strategy, a means of self-medication. So for addiction treatment to be effective, here are 5 points to keep in mind. First, we must honor the traumatic parts of our patient's childhood by creating a safe space to develop coping skills that can replace their substance use before we move into a deeper trauma processing. This ensures that whatever may be re-experienced in treatment, our patients have the healthy coping skills they need right in their toolbox. Seeking safety is one evidence-based treatment that facilitates exploration and practice of healthy coping for patients with substance use disorders and a history of trauma. Second, we must honor our scope of practice. If you are a clinician whose training is only in substance use disorders, guiding a patient as they work through their traumatic experiences can do more harm than good. It's best to refer our patients to someone on staff who is a licensed mental health counselor or has been trained in trauma therapies. Third, substance users with a history of childhood trauma benefit immensely from treatments that are meant to rewire the brain so it's no longer in survival mode. Treatments like medication, mindfulness, breathwork, and yoga. Fourth, to avoid exacerbating a person's traumatic stress and substance use, we must move forward with empathy and compassion. This is called trauma-informed care, and SAMHSA provides us with 7 key ingredients that we must include in our programs for them to be labeled as trauma-informed. And fifth, help your patients to build social support. As we begin to create cohorts, using trauma history as one consideration could help us to connect patients with similar childhood experiences who can identify with and support one another. If you're looking for more information on today's Did You Know video, connect with me by sending an email to training@phoenixhouse.org, and I'll send you a quick reference guide on childhood trauma and addiction. And now you know.